purpose of this segment is to cover exercises after ankle surgery. Now once we've done the ankle surgery, it's important to maintain the movement of not only the ankle joint, but also the subtalar joint and the midfoot, as it all works together. Allow me to introduce again Julian Russell-Jones, who is the physiotherapist principal of Performance Edge Physiotherapy, and Nikki, who is our willing subject. So Julian, after we've done an ankle arthroscopy, and where there's no immobilisation, we're very keen for people to mobilise, aren't we?
Exactly.
So let's just talk about how we might do that and what sort of exercises are appropriate.
Okay, the exercises for the ankle, which is the joint which has been operated on, probably there are three main directions we'd like to go: up and down, side to side, and then a combination of maybe circling of the ankle joint. These are best achieved, perhaps I'll run through them one at a time. The up and down one, if Nikki you'd like to bend your knee a little bit, that takes the tension off some of the muscles at the back of the calf. Now if you just like to pull your foot up and down.
And so reaching the absolute end of excursion for each range I think is very important, don't you? A lot of people come up to a certain point and they think, oh that's enough, and then they just do this. But really going right to the end of range and holding it there to make sure that you've achieved maximum range, and then all the way down, and once again holding it there, seems to achieve a better result. Once again, as you've said, bending the knee makes a lot of difference. And what's the next segment of this?
Okay, the next basic movement that the ankle will do is at the subtalar joint, which is the range of inversion, which is pulling the inside of your foot towards the other foot, and eversion, which is taking it away. And so, Nikki, if you'd like to pull all the way in, as far as it's comfortable, and then all the way out. And as Paul said before, it's important to get to the end of each range, and it's much better to work on quality and full range of movement than just doing a little bit in a hurry.
And you know, one of the other things that people do is that, in my experience, they often move their toes up and down and don't achieve any movement at the ankle joint. So it's important to realise that you have to be actually moving the ankle and moving the subtalar joint rather than just twiddling your toes around, which of course, it's something that's very important, isn't it?
It is. And I think the main problem is they feel that because their ankle has been operated on, they don't want to move it. So everything else will move, but the very bit that we want to move.
Exactly. But you should be confident that when we are finished the surgery, we're confident that nothing is going to fall apart. So if we're confident, then you should be too. You'd agree with that, wouldn't you?
Yes.
Yeah. And if I felt that there was something that I didn't want you to do, I would tell you. And I might even put you in a plaster to immobilise you. So if you're not in a plaster, you need to be moving. And how often do you think we should be doing this?
I think every hour you should be running through 10 of each movement pattern.
Exactly. Now it's been my observation that some people, despite their best intentions, still don't achieve much movement at the ankle joint. And it's those people that need that sort of next step, which is to put some weight through the foot, and maybe we should then move across and talk about that now. There are certain people who find it very difficult to achieve ankle movement, despite the things we've shown you. There are some useful tricks, and I can see that you have one of those tricks in place right away. Could you tell us what the point of this is and how you might have set it up?
Okay, well Nikki here is wearing a seatbelt, which is attached to her foot, and as you can see her foot's been stretched back, so that's getting a stretch through the ankle joint and also through the calf muscles at the back of the lower leg. The way to achieve this is, if Nikki bends the knee up, we supply the seatbelt, and the seatbelt will clip around. You have to make an adjustment so that it's almost starting to get firm with the knee bent, and then as Nikki straightens her knee out, the tension comes on and we achieve that range of backward bending or dorsiflexion at the ankle joint. Now this is very easy for Nikki. She can be doing her exercises while she's absolutely doing nothing.
Yeah.
Be reading the paper or...
And if she didn't have a seatbelt, say you didn't have any or she didn't have any, we could use something else, couldn't we?
Yeah, whatever's at hand. A towel's probably the next easiest thing.
Okay.
So everybody's got a towel at home,
Yeah.
towel or a sheet, and just wrap it around and hold both sides. So if that was a towel, you could just be holding like that and can hold it for as long as it is comfortable.
And once again, this needs to be done regularly.
Regularly.
We would like to see this done at least once an hour. In addition to this, the use of gravity is very helpful. And what we might do is move over and show people how to do that.
Okay.
So Julian, if we're having difficulties achieving ankle movement lying down or with the strap, we'd like to show people how they can do that using their own body weight and some very simple things, often in their own home. So can you just take us through how you might show Nikki to do this?
Okay, so to achieve the range of dorsiflexion, or this movement at the ankle, probably one of the easiest things around the home is a step. Most people will have a step or a gutter that they can actually stand on. And I'll just take Nikki through what we want to achieve. So if Nikki, you'd like to stand up and step up onto the step with your good foot, okay, and then step up so that the ball of the operated foot is on the edge of the step, and just holding on to support for safety. Just lean your body weight down through that left foot, and you can see that the heel drops down below the level of the step. So that's achieving a stretch through the calf muscle and the ankle joint.
And this is to be held for 5 seconds?
Everybody has their own little time that they like to hold it, but 5 seconds is a good starting point.
Yes.
And the progression from this might be, if Nikki, you'd just like to bend your knee, that will take the tension off the long calf muscles and put more on the shorter, deeper calf muscle, and also allow perhaps a little bit more movement at the ankle joint.
It's very important to emphasise that you have to do this on a stable platform. This step is of course unstable, so we'd like you to use something that isn't going to move so that you don't fall over. And it's also wise to look for some type of handhold or have someone with you while you're doing this sort of thing. Now, to progress on from that, I notice you have another piece of equipment here. Would you hold down? This is a perhaps more sophisticated method of achieving the same thing, isn't it?
Yeah, this is what I'd call a slant board or a sloping board. It was actually something I made from the remnants of building a pergola, but most people might have something that they can use which is equivalent to this. It provides a stable base and a ramp, if you like, for the foot to stand up against, and it'll achieve the same sort of stretch. So if Nikki, you'd like to stand up, and if you stand next to it with the good foot and put the heel down and the foot on the slope board, and then just lean your weight forward. So take your weight forward from the hips, and you'll see that that's achieving a really good range of ankle movement.
Now, of course, it's very easy to be kidding yourself with all of this, isn't it? So it's very nice for us to be able to show that you're really achieving what you'd like to achieve. Pop off if you don't mind, Nikki. Can you just show us how you might do the knee to wall distance so that you can so people can understand when they're really achieving what they need to be achieving?
Okay, if you line your toes up against the wall and then try to take your knee forward to the wall. So Nikki's actually past that one, she's a bit advanced. But to begin with, it may be that you're really struggling to get your knee forward at all. So put your toes right into there. And so you can go have a guide of exactly how you're going by where your foot is in relation to the wall, with your knee in contact with the wall.
And you can tell, can't you, that generally speaking your other side is good.
Yes.
So the distance between the front of your toes and the wall, with your knee in contact with that wall, would be regarded as normal on the normal side, wouldn't it?
Yes.
And you would then be able to determine whether the exercises that you are doing on the other side, which is the side often subject to surgery or injury, is comparing.
And that's a good way to map your progress as well.
And the physiotherapist will talk about that a lot, and I'll be interested in knowing when we see each other after the surgery.